Okay, hello. I'm a little under the weather, so I apologize for my voice. So here we've got atherosclerosis. So characteristics of atherosclerosis. This is a condition characterized by the thickening of blood vessel walls because of accumulation of lipid concentrated macrophages. So it's not just going to be lipid cells, it's going to be macrophages surrounded by these lipid cells. It's going to form lesions called plaques in your arteries. So inflammation responses in the body, those are helpful to fight infection that you might get, but in this case they might be negatively affecting us just because any injury to your artery walls is going to cause an inflammation response and then help that plaque build up that you might get. Atherosclerosis is a type of arteriosclerosis, which refers generally to a thickening or hardening of the blood vessel wall. So that's sort of an umbrella term here. Atherosclerosis is a broad process, so it's going to be causing a number of ischemic diseases. So that might be peripheral, coronary, stroke, stuff like that. Signs and symptoms may not become obvious to those affected until they have a medical emergency. So you might contract the disease early, and then later on in life it's going to become a problem for you. So, for example, you've got your peripheral artery disease, that's going to cause poor circulation to your limbs, poor blood flow, and then coronary artery disease, that'll cause chest pain. That's just a few of them. So pathophysiology, this is sort of an overview. Blood vessel walls are lined with endothelial cells, and atherosclerosis forms from an injury to the endothelium of the blood vessel wall. So you're going to get a tiny little nick in your blood vessel wall, and that's going to cause problems as it builds up those inflammatory cells in that plaque. So lesions caused in the blood vessel walls, they're going to progress into fatty streaks, and then eventually that might cause fibrotic plaques, and these are called atheromas. Injured blood vessel endothelial walls become inflamed, and this inhibits the blood vessel's ability to produce these cytokines that are helping your blood vessels, such as antithrombic acid and vasodilating cytokines. So that's going to increase the radius of your blood vessels to help try and dissipate that clot, that plaque in there. All stages of this disease are considered inflammatory responses to injury of the arterial endothelium. So that's where this all stems from, is just an injury to your artery wall. It tends to affect certain points more than others of the vascular system, especially branching points of your arterial tree. That's going to inhibit the arteries from producing these helpful cytokines, nitric oxide, that's an important vasodilator, again, increasing the diameter of that blood vessel. So this is a more detailed look at the pathophysiology of arteriosclerosis. T cells and monocytes, these are immune response cells. Those are going to migrate to the subendothelial space. It's going to get right under your artery wall, and that's an immune response to your arterial damage. It's like, what's going on? Let's go look at it. These migrated monocytes are going to transform into macrophages, which are a larger immune response molecule, and that's going to trigger a local inflammatory response. So it's going to say, hey, immune cells, come help, we've got an injury. LDL and VLDL, very low density lipoprotein, cholesterol lipids in the blood, so they're just circulating all the time. They're going to bind to injured epithelial cells, and then these lipid cells are oxidized into foam cells by the macrophages. So the macrophage, surrounded by these lipids, it's going to produce these fatty streaks along the walls of your arteries, and I'll show you a better look at that. Macrophages recruit inflammatory cytokines. That's going to cause smooth muscle cells to migrate, connective tissue, fibrin, collagen, and these are all going to contribute to these, it's a connective extracellular matrix, that's that fibrotic plaque. Total structure of lipid cells, foam cells, macrophages, smooth muscle, and connective tissue, that's going to be called the fibrotic plaque. And over time, the plaque can calcify, and it's going to be similar to bone formation. So little by little on the surface, it's going to be building up. So here's a good look at a little bit more in depth of atherosclerosis. So We've got the normal artery. Fatty streak is forming here. That's that macrophage foam cell. Early atheroma, it gets underneath there, builds up. So stabilized plaque, vulnerable plaque. So I'll get into that. Here's a closer up look at this plaque formation. So you've got these macrophage, lipid engulfed macrophages, foam cells. Smooth muscle is migrating. And then over here you've got some collagen formation and all of that. T cells, monocytes, and there's a lipid core there. So different types of plaques, like I said, there is a stable plaque. Those are going to remain static, grow slowly over decades. They can cause occlusion in the future. So these are the ones that you might get in your leg, and then by the time you're 49 or 50, it's going to be causing you some ischemia problems. An unstable plaque, these are more serious. So these are the ones that could spontaneously rupture, become a circulating thrombus in your blood. And these, depending on where they are, could cause a heart attack, a stroke, and cut off circulation to those important organs. Treatment to stabilize the plaques may reduce morbidity and mortality. So if you have an unstable plaque, building up this fibrous cap might help it stay where it is, and so it doesn't break off and cause problems. Okay, so causes and risk factors. High concentration of LDL cholesterol in your blood. So this is going to be bad because it encourages damage to blood vessel and promotes the accumulation of those plaques. So once the T cells and monocytes migrate, those LDLs circulating around are going to hop onto that macrophage and say, I'll hang out with you. Low concentration of HDL cholesterol, this is considered your good cholesterol because it's important for clearing out the LDL, taking it to the liver to be reuptaked and eliminate the LDL through your body waste. They might be used to produce hormones. Hypertension, so if you have a high blood pressure, it's going to be increasing the possibility that you get a little bit of endothelial damage in your arteries. Makes them vulnerable to suffering damage, and then you have that fatty buildup and the plaques. Smoking, chemicals found in cigarettes can vasoconstrict and increase the risk of damaging your artery endothelium. They'll raise your blood pressure and raise the bad cholesterol circulating in your body. More causes and risk factors we've got. Insulin resistance, so this is type 2 diabetes. Higher blood sugar is going to increase the amount of molecules circulating through there and encourage plaque formation. Obesity, sedentary lifestyles, greater than normal body weight, increases risk factors such as diabetes, hypertension, high cholesterol, and an increasing number of children are at risk for atherosclerosis just because of this obesity epidemic that we've got going. Age, risk will increase with age. Plaque buildup over time begins to show at 45 to 55. Family history, if your mom or sister was diagnosed before 65 or your dad or brother before 55, that might increase your risk. However, it's not guaranteed. If you're actively managing those risk factors, then it will decrease your risk. So clinical presentation, depending on where you're suffering this atherosclerosis, it's going to present differently. And again, it might not produce signs and symptoms until you're already suffering a medical emergency. So coronary arteries, this might be present in the form of angina pectoris, so that's chest pain or pressure, or in your arm, shoulder, neck, or jaw, that's common as well. It might include arrhythmia, so irregular heartbeat, your heart's just not doing something correctly. Carotid arteries, so supplies blood to your brain. If that has atherosclerosis there, you might experience stroke symptoms, so that's going to be weakness, fatigue, paralysis on one side of the body or face, slurring speech, stuff like that, loss of balance. In your peripheral arteries, these are major arteries supplying your extremities with oxygen. So oxygen-rich blood could become narrowed by plaque. So you're going to have numbness, pain in your legs and arms. If you're diabetic and you have an infection on your toe, it might be exacerbated by this atherosclerosis. You might not be able to heal correctly because your blood's not supplying that limb to heal it. Renal arteries, your kidneys are really important for producing red blood cells, filtering blood, and excreting waste and all that. So if your arteries serving your kidneys aren't blocked, it's not going to be good for you. It might result in chronic kidney disease. So testing and evaluation, they can do a physical exam. That's going to be listening with a stethoscope for a bruit or a whoosh sound that's going to be saying your arteries aren't getting adequate blood flow there. Checking leg pulses to see if they're weak or absent, that can indicate blockages there. Diagnostic tests they can do, that's going to show the relative levels of HDL and LDL cholesterol in your blood. Blood sugar, proteins in the blood, abnormalities will put the patient at risk. And EKG, that's going to show your electrical rhythm, so the different waves of the EKG indicate which ventricle and atrium are contracting. So if they're not getting adequate blood flow, those ventricles aren't going to be pumping correctly. So testing and evaluation, we can do a chest x-ray. That's going to give you a better picture of what's going on in the vascular system. Ankle brachial index, this is comparing the blood pressure in your ankle to the blood pressure in your arm. It can reveal signs of peripheral artery disease. Echocardiography, so that's an echo. It's going to show a moving picture of your heart so they actually can see it in action and see which ventricle isn't contracting correctly, or valves. CT scan, pretty much anywhere gives you a better look at what's going on inside, but it's great for showing that narrowing of blood vessels or clots forming. Stress testing, that's going to make your heart work a little bit, so as your heart works harder, it needs more oxygen and blood flow, and you're able to see the dramatic changes in heart rate or blood pressure. That's going to indicate atherosclerosis. So possible complications, as we've said, stroke, heart attack, peripheral and coronary artery disease. Those are just a few of the ischemic conditions that can result from atherosclerosis. So epidemiology, we've got, this is a leading cause of morbidity and mortality in the US. In 2015, it caused almost 15 million deaths worldwide. So it's increasing in prevalence in developing countries and decreasing in already developed countries. So this will increase the incidence worldwide. It's decreasing in our countries because of increased treatment and lifestyle changes that we're making, positive changes to fight this. So treatment and genetic counseling. So diet modification. Anybody can do this. Lower the amount of saturated and trans fat that we're eating. Increasing more fruits and vegetables. They've got phytochemicals that are believed to reduce risk of coronary artery disease. More fiber. Fiber is going to help flush out that LDL cholesterol and decrease that content. Moderate alcohol intensity. So alcohol actually will increase your good cholesterol to an extent, but if it's in excess, then it's not going to help you. Quitting smoking, again, smoking increases the damage done to the artery walls, so, and it also increases your cholesterol levels, so quitting will help lower those. Physical activity. It's unknown which frequency or duration of physical activity is most effective, but we know that it reduces the incidence of those risk factors like obesity, diabetes, hypertension, and all that. So drug treatment. Statins are used to lower LDL cholesterol in blood and enhance nitric oxide production. That's that important vasodilating hormone. Stabilize existing plaques. So statins are used to say stable plaques, stay where you are, don't rupture and start circulating through my body and maybe cause a blood clot. Antiplatelet drugs, so if you have a fibrotic plaque and it ruptures, your platelets are going to run to it and start coagulating there to make sure that it doesn't move through your body. So antiplatelet drugs, these are aspirin, your blood thinners. Those are going to help reduce that accumulation of platelets in your blood. So ACE inhibitors, these are going to help block the uptake of LDL cholesterol in your small intestine. So we'll reuptake that, but it's sort of inhibiting that so we excrete more LDL cholesterol and keep that at a better level in our blood. Genetic principles, so It's believed that environmental and genetic influences cause this condition, but as far as genetic goes, they have found single gene disorders. These are Mendelian, and they cause an increase of plasma LDL by impairing the receptors in your liver to reuptake the LDL cholesterol. So that would be this LDLR gene. If you're heterozygous for it, you'll only have about half of the receptors, so you'll have higher LDL cholesterol. But if you're homozygous, it's more severe, and you might be experiencing heart attacks in your childhood, stuff like that, very severe heart conditions. And that's just one of these single gene disorders that they've identified relating to atherosclerosis. They believe that most cases are caused by several genes working together on this ApoE gene group, and it affects lipid metabolism. They think that several alleles are raising those lipid levels in your blood. So moving forward from here, the most important intervention we can take is consciously managing those risk factors. So the physical activity, the diet modifications, lowering blood pressure, quitting smoking, stuff like that. Research on less established risk factors, so those are those genetic. They said, this article I was looking at had many, many different possibilities for genetic research for atherosclerosis, and this could reveal more details on the heredity, how we get it from our family, and the pathogenesis of the condition, how it's actually happening and why. So these are my references. Thank you.